Welcome to our sonography lecture on spleen pathology, part 4 of 7, other diffuse diseases for the sonographer. This lecture is going to cover myeloproliferative disorders, granulocytopetic abnormalities, Reticuloendotheliosis, specifically looking at Letter-Sewe disease, and Hand-Schuler-Christian disease. We are going to begin with myeloproliferative disorders. Myeloproliferative disorders are a group of rare illnesses that cause blood cells in the bone marrow, including red blood cells, white blood cells, and platelets, to grow and develop abnormally. So we've already talked about a few myeloproliferative disorders that affect the red blood cells in our erythropoiesis lectures. We're just going to look at a brief list of other myeloproliferative disorders that affect the white blood cells. Myeloproliferative disorders include polycythemia vera, and they can also include many leukemia variants, including acute myelogenous leukemia, chronic myelogenous leukemia, myelofibrosis, megakaryocytic leukemia, and erythroleukemia. Now, this is a big list of leukemias. The biggest thing to take away from the myeloproliferative disorders is that, again, it affects how the red blood cells are made, and this is going to be more disorders of the bone marrow. Polycythemia vera is a subset of myeloproliferative disorders. So is acute myelogenous leukemia. And acute myelogenous leukemia, or AML, is the most common myeloproliferative disorder that affects the white blood cells. So here's a patient with AML. They have a very large spleen. It is heterogeneous in appearance. We might start to see some splenic masses and enlarged lymph nodes in AML patients. So here's our very large spleen. We can see it's very heterogeneous, kind of seeing some splotches in here, some different echo textures, and then we actually have a large lymph node at the hilum of the spleen as well. Next up, we have granulocytopetic abnormalities. Granulocytopetic abnormalities particularly refer to abnormalities with white blood cells. So granulocytes are a subset of white blood cells, and these again are also caused by certain bone marrow diseases, but we can also see these white blood cells having abnormalities due to chemotherapy, certain drugs, HIV, and some infections. The infections that we most commonly see with granulocytopetic abnormalities are histoplasmosis and tuberculosis. It is not uncommon to see granulocytes or granulomas on the spleen. Basically, what these granulomas are made of are granulocytes, or white blood cells that were needed for treatment of an infection or to attack an infection, and then they kind of just get caught in places. So we see them in the lungs, we'll see them in the liver, we can see them quite often then in the spleen as well. So when a patient is infected with a disease that might need these granulocytes to kind of activate and help get rid of the infection, it's not uncommon to see subsequently a spleen that is kind of sprinkled with these granulocytes. So you can see in the spleen here, we have a normal spleen, but we have these little dots all around, and those are those granulomas or the granulocytes. This patient has quite a few of them. Again, it is not that uncommon to see a couple bright white spots scattered through the spleen in people who have had infections. Next up then, we have Reticuloendotheliosis. The spleen is part of the Reticuloendothelial system, which is basically our disease-fighting system. And the Reticuloendotheliosis then is going to be characterized by hyperactivity of the reticuloendothelial system and how some of the phagocytes that are part of the reticuloendothelial system, how those phagocytes store fats or lipids. There are two types of reticuloendothelial diseases that we need to focus on because they do affect the spleen, and those are Letter-Sewe disease and Hand-Schuler-Christian disease. Both of these diseases are going to cause the spleen to become large. So we'll start with Letter-Sewe disease, which is kind of the old term. It is now known more prominently as Langerhans histiocytosis. So Letter-Sewe disease is a subset of reticuloendotheliosis diseases, and what happens is it causes the reticuloendothelial system, the cells that make it up, it causes them to just explode. There's tons of them in the body. And what we see then is that there's cells start to collect within the tissues. This is also known as non-lipid reticuloendotheliosis, which seems really weird because we just talked about reticuloendotheliosis diseases are not only the proliferation of RE cells, but also the lipids that are stored within the phagocytes. This one just happens to be a non-lipid version of these diseases. This is commonly seen in children under the age of 2. So Letter-Sewe disease presents in children under the age of 2. It is typically going to be a fatal disease. When these children present, they are going to present with hepatosplenomegaly, a fever. They're probably going to have some sort of pulmonary involvement, and they will present with this very particular rash, kind of these red dots all over the skin. Hand-Schuler-Christian disease then is another subset of reticuloendothelial diseases. It is also rare, but this one is benign, and it's a chronic condition that causes fats to accumulate in different spots of the body. Now, this is going to manifest differently than what we talked about with Niemann-Pick disease. Again, this one is not fatal, and it typically affects children over the age of 2, where Niemann-Pick disease was children under the age of 1, typically female infants. Hand-Schuler-Christian disease causes these lipids to accumulate all over the body. So we can see it accumulating in bone, particularly the skull. We'll see it in the skin and then in the viscera, particularly the spleen. So as I had mentioned before, these patients are typically over the age of 2 when they are diagnosed, and they actually have a high association with diabetes. You can see in the picture here a child who has those lesions in the skull due to excessive fat being collected within the skull bone. So I realized that was kind of a quick overview of some of these diseases. Again, these are all really pretty rare diseases, and so I don't want to spend too much time on them. I think your big takeaways from this section are going to be that myeloproliferative disorders can cause red blood cells, white blood cells, and other blood cell components to be created improperly. And so we talked about polycythemia vera, and the big one on that one is leukemia, and that's going to be more affecting the white blood cells. Secondly, know that granulocytopetic diseases are going to cause the granulocytes to proliferate. There's going to be lots of them, and they're going to go out and try to fight infections. And after they fight the infection, sometimes they get cut up in places. And so it's not uncommon for somebody to have an infection and for us to later see little white dots. Sometimes we can see them in the lungs. Oftentimes, it's a really common thing that we see in the spleen. So they call those granulomas, those little white dots. And then lastly, we had 2 diseases that fit under the reticuloendothelial umbrella, Letter-Sewe disease and Hand-Schuler-Christian disease. Remember that Letter-Sewe affects young children under the age of 2. It is fatal, causes splenomegaly, causes too many reticuloendothelial cells to be produced and then get caught up in the body, where Hand-Schuler disease, again, also causes excessive RE cells to accumulate and be produced, but these have more fat within them and they cause more lesions on the body, not fatal, and typically diagnosed over the age of 2. I think if you can remember those key things about these diseases, you'll have enough knowledge for your boards and tests in regards to other diffuse diseases of the spleen. So next up, we're going to talk about part 5, the focal splenic pathology.